Hi guys, this is Carrie. We're going to be talking about neurological disorders 3 from a few weeks ago, focusing on peripheral nerve injury, brain trauma, and spinal cord injury. I'm going to advance the slides as I speak about them. So first of all, normal A&P of the spinal cord. The peripheral nervous system consists of cranial and spinal nerves, including branches and ganglia. A peripheral nerve is composed of axons wrapped in a myelin sheath, which are arranged in bundles called fascicles. The 31 pair of spinal nerves get their names from where they exit, which vertebrae they exit. So the first 7 are called the cervical vertebrae. The next 12 are the thoracic vertebrae. The next 5 are the lumbar vertebrae. And the last 5 are the sacral vertebrae. And the nerves, the cervical nerves, the thoracic nerves, the lumbar nerves, and the sacral nerves all exit from where those vertebrae lay. This is another picture showing a spinal cord, the root, how the nerves enter and exit from the spinal cord, the myelin sheath that it's covered in, and when you have a bundle here, that is a nerve bundle. And they all end at the level of the skin, which is where we have our pain receptors. So peripheral nerve injuries. The site of injury can be at the axon, the spinal root, the plexus, or the peripheral nerve. And there are many different diseases that may affect the peripheral nerves. The first one that we're going to talk about is a generalized symmetric polyneuropathy, which is a symmetric involvement of sensory motor or autonomic fibers with many clinical signs. The most common cause of this are diabetes and alcohol abuse. We also have generalized neuropathies, which affect the cell body of only one type of peripheral neuron. So ALS, for example, or poliomyelitis affects the neuropathy, is a neuropathy of just the anterior horn. We may have compression of sensory or nerve fiber, of sensory and motor fibers, for example, in carpal tunnel syndrome, which is shown here. We have damage to the medial nerve, or we can have damage to the ulnar nerve or the perineal nerve. The most common peripheral neuropathy is caused by diabetes. So diabetes causes angiopathy, so disease of the blood vessel. It can either be large vessels or small vessels, which then start to affect the nerve that is attached to that blood vessel. So what happens is we have glycoproteins, sugars, all kinds of other free radicals that have started to damage the blood vessel, so any of the blood vessels here, and then they go on to damage the nerves, and people end up with something called neuropathies, which cause decreased sensation to the affected area. Just going to switch the slide. So nerves can regenerate if, depending on where the location of the injury is. So the closer we are to the cell body of the nerve, so here, the better the chances of permanent damage. For example, if I have a crushing injury, so my arm gets stuck in something and becomes crushed, we may have more recovery because we haven't damaged the actual neuron, the actual cell body here, than if I have cut my entire nerve with a knife by accident. The inflammatory response that happens in all injury helps to encourage the regeneration of the neurons. Brain trauma. So brain trauma is if we experience brain trauma, that is the highest risk of traumatic brain and spinal cord injury. The people that are most at risk for this are males with a low to medium income, children, so 4 and under, adolescents, 15 to 19 years old, and older adults. Causes are motor vehicle accidents, greater than 50%. Are caused by motor vehicle accidents, falls, violence, and then sports-related events, so high-risk sports, that would be. So we have the primary injury, which is here. So the primary injury would be the car accident, which would cause direct impact, or we could have a laceration, we could have a fracture, followed by hemorrhage. So depending on what level of the dura is affected, we could have an epidural hematoma, which is bleeding under the epidural layer, or on top of the epidural layer, sorry, a subdural layer, which is bleeding underneath the dura, or intracerebral, so right in the tissue. So if you remember from our previous lecture on membranes, we do have the dura mater, which is the first membrane closest to the skull, then the arachnoid membrane, then the pia membrane. So epidural would be on top, subdural would be under that membrane, and intracerebral is inside of the tissue, arachnoid underneath the arachnoid dura. Brain injury, other than just a concussion, the actual mechanism that is in effect here is called diffuse axonal injury. And what happens is that the brain tissue and the axons in the brain actually pull and tear, and that is what causes part of the damage in a brain injury. So that yes, there's swelling, yes, there may be bleeding, but the big part of the injury is caused by diffuse axonal injury. So actual injury to the axons, so to the nerves in the brain. After the primary injury of some kind of car accident or fall and hit your head, then there are secondary injuries. So terms that we use to discuss head injuries, it can either be blunt, which is a closed head injury, fall and strike your head, have a car accident. The dura remains intact. We can have a injury that is open, so a penetrating injury, so such as a car accident that is severe enough that you actually have a skull fracture and you have injury to the dura and your cranial contents are exposed to the environment. Or we can have a focal brain injury. So a focal brain injury would be a contusion, a epidural hemorrhage, or a hematoma. This can happen in blunt or open brain traumas. It can also happen in skull fractures or coup or contra coup injuries, which we are going to talk about as well. And the diffuse axonal injuries, they are more disabling, cause less death. So this is something like a concussion where you have tearing of the neurons inside the brain, but you do not have, it is not a open head trauma, but these people can have increased intracranial pressure, they can have coma, amnesia, concussion syndromes for weeks and weeks and months and months. The most common injury that we're having is a focal brain injury, which is 50%, but actually causes 2/3 of death. So what is a brain injury? So we can either have a contusion or a concussion. A contusion is blood actually leaks from tears in blood vessels. It is normally in the frontal lobe, so the front of the brain. It can lead to hematomas, hemorrhage, infarction, which are strokes, necrosis of tissue, edema, or increased intracranial pressure. Or we can have a concussion. where the symptoms can be either transient or permanent, and it can be confusion, headache, nervousness, disorientation, and amnesia. So there is not bleeding necessarily in a concussion, but a contusion actually means a small amount of leaking blood from tears in the blood vessels, either from a blunt trauma, a open trauma, or diffuse axonal injury. So what is a focal brain injury? So coup and contra coup. So what this means is that the coup injury is if you're in a car accident, you get hit from behind in a car, your head hits the windshield. The initial impact of that is called your coup injury. That's the site of impact and the direct trauma to the brain. We then have shearing, so of the subdural veins, and trauma to the base of the brain. The contra coup injury is when my head flips back from the impact, we have damage to the opposite pole of the brain. So this hit, the initial hit, is the coup, and the hit to the opposite area of the brain from impact, so to the back, so this would be my occipital portion, would be contra coup. So here are some pictures of coup and contra coup, and coup and contra coup, and some of the axonal shearing that can happen, which can cause permanent brain trauma and damage that can happen in a coup and contra coup injury. You don't actually even need to hit your head to have a coup or contra coup injury. You can have whiplash, so you can get hit very, very hard from behind or have a violent fall, not hit your head, and the impact of the brain tissue hitting your skull and the velocity in which that happens can actually cause a coup or contra coup injury. So, what is a hematoma? A hematoma, the most common causes, motor vehicle accidents, falls, high-risk sports. And depending on where they are, like I said, they can either be epidural, above the dura, below the dura, subdural, or in the brain tissue itself, called an intracerebral hematoma. These bleeds, depending on how large they are, will cause increased intracranial pressure, which will decrease your cerebral perfusion pressure. So increased intracranial pressure from bleeding in your brain will decrease the cerebral perfusion pressure, so the amount of blood getting to your brain. So here are some pictures of subdural hematomas. This is an epidural hematoma. Okay, so this person fell and hit their head. This is a subdural hematoma here, and this is an acute intracerebral bleed. So this also could be called a hemorrhagic stroke. So we have a bleed in the brain tissue itself. It may have been from a clot and ischemia, or this may have happened as a result of a head trauma. So spinal cord injury. Spinal cord injury happens most commonly to young men. 81% of people who have spinal cord injuries are men. Average age is 33 years old, and also elderly adults are the other percentage. So this happens mostly due to motor vehicle accidents, which are a major trauma, and falls. So spinal cord injuries, we can either have a vertebral injury we can have a fracture or a dislocation, and we can have a compression of the vertebrae, or we can have a fracture of the vertebrae, and depending on the area of vertebrae that is damaged will depend on the effect that you have and whether it is a partial or a full tear of your vertebrae and then your spinal nerves. We are going to switch videos now, and I'm going to post a second one continuing with this because we're almost out of time. So let's hold on, and we're going to switch again, and we will start on slide 15.